Dear colleagues, this is Cataract grade 3 plus done in subconjunctival anesthesia, making two paracentesis using micro forceps. I'm able to fashion a round capsulorhexis, doing some hydrodissection using the hydrodissection cannula to tap the nucleus and rotate a little bit, doing some more hydrodissection and enlarging one of the paracentesis, placing some viscoelastic, and then I'm doing the pre-chop using the long chopper and doctor's Sohel pre-chopper. I'm able to crack this 3 plus grade nucleus into two sections, placing some more viscoelastic inside the anterior chamber, and then again using the long chopper and Dr. Khan's pre-chopper. I'm doing another pre-chop and have one of the heminucleuses divided into two quadrants. First pre-chop went all the way through. The second one, I'm not that sure, but continuing the phacoemulsification, getting in the phaco probe and aspirate the cortex on top of this kind of a brittle nucleus, engaging one of the quadrants and try to separate them all the way through the posterior plate of the nucleus. Aspirating the cortex a little bit more, rotating the nucleus, and then I'm doing another horizontal chop and separate all these quadrants. I'm able to slowly emulsify, taking out small pieces and sub-chopping a little bit more to keep the phacoemulsification inside the bag. We have to be patient and separate the pieces well, and then it's easy to get them aspirated and sub-chop and slowly take them out of the eye. Now I'm left with two quadrants. I'm further chopping this into smaller and smaller pieces to be able to use less ultrasound and to be able to keep the emulsification as far as possible, as long as possible inside the bag. Last part of the third quadrant is slowly aspirated, And then the last quadrant is safely emulsified, having the back posterior capsule protected by a piece of the epinucleus, which is no longer there. I'm aspirate that. So try to get the last quadrant slowly emulsified and chopped into smaller pieces in order to not have a fluctuation into the anterior chamber. This way we'll keep the posterior capsule far away from the phaco needle. At the last piece, it's important to keep the chopper at a lower level than the phaco probe, and further divide that nucleus to have aspiration, not so much ultrasound. Cleaning up the last part of the cortex using the aspiration needle through the paracentesis and the AC maintainer through the main wound, main incision, and using the sandblasted tip of the aspiration kernel. Now we are able to polish the posterior capsule and have a clean one at the end of the cortical aspiration. That's pretty much the last part. Injecting the IOL inside the bag using the AutoSert system, and then washing out any viscoelastic from the anterior chamber, and that's pretty much the end of the case. Thank you for your attention. Hope this will help you in your practice also.